Do you suffer from diabetes? Did you know that diabetes can be the reason for having foot issues that can lead to amputation? Hi, my name is Dr. T, and I am a surgically trained podiatrist from Santa Cruz, California. In my practice, I see patients with diabetes every day. Some of them will come to me for foot pain, while others come due to a severely infected diabetic foot ulcer that requires an amputation. But how can you avoid that kind of complication? Today, I will explain what the diabetic foot is, and if you stay until the end, I'll give you 12 tips to help avoid preventable lower limb amputations. Before I get started, please be sure to subscribe to my channel or check out the website for more resources. An educational disclaimer: this is not medical advice, so please speak with your doctor before deciding to change or implement any recommendations set here, which is really for educational purposes only. Now, the diabetic foot describes foot problems seen in people who have diabetes, which happens over time. So people with diabetes may experience nerve damage called peripheral neuropathy, circulation problems where not enough blood flows to the toes, and structural changes like stiffening of the tendons that lead to a hammer-toe deformity or a sudden collapse of the bony architecture in severe cases called Charcot-neuroarthropathy, or simply Charcot foot. Diabetes is the leading cause of non-traumatic lower limb amputations. That is in contrast to traumatic amputation, in which there was no control or there was a freak accident leading to losing a limb. Non-traumatic is equivalent to a surgical cause for an amputation. And 1 in 4 diabetic patients can develop foot ulcers, which is a hole or a crater in the foot, and at least 1/4 of these ulcers do not heal, so they risk amputation. There are many complications that diabetes can cause, but the worst is the amputation of your toes, your foot, or your leg. Ignoring these simple tips can lead to foot complications that won't heal and end up causing permanent disability. Comprehensive foot care programs can significantly reduce the risk of amputation, which is offered by many podiatrists like myself. Research has shown that these programs can reduce amputation rates by up to 85%, and they are necessary because of this alarming mortality rate. Up to 10% of people with diabetic foot ulcers may not survive past 1 year, so we have to give feet the attention they deserve, even if they're not hurting. Now, let's get into why it's important to understand the diabetic foot. Poorly controlled blood sugar outside of the target range for a sustained period of time leads to damaged blood vessels, both big and small. Small vessels that bathe the nerve provided oxygen and essential nutrients, so without it can lead to nerve damage. Blood vessels also get damaged, leading to poor circulation or bad blood flow. And in diabetes, the small vessels are affected first, called microcirculation, which affect the toes, and then it can affect bigger vessels, including the ones in your heart and your brain. So if the blood vessels are not functional, it can lead to a wound that does not heal, or a condition called gangrene. So in short, diabetes affects circulation and the nerve, leading to those who may not be able to feel their feet or developing a wound that won't heal. This then leads to an infection, hospitalization, and amputation. This is why people with diabetes need to be proactive early on to protect these things from happening. So here are my 12 tips that can help you prevent a foot amputation. Number 1, get a comprehensive foot evaluation at least once a year as soon as you are diagnosed with pre-diabetes, diabetes, or notice anything different about your feet. These evaluations come with education, a risk assessment, and recommendations that you can start implementing right away. Number 2, now put your podiatrist on speed dial. Once you are established, you will have faster access to them, and many like myself accommodate same-day appointments or telehealth assessments to determine if you need to be seen in the office or you have to go to the emergency room. Number 3, do daily foot checks and observe for any changes with your nails and your skin. You need to know what your normal looks like a mole and your foot shape, and make sure to check between the toes and the bottom of the foot. If you can't see the bottom of your foot, you can place a mirror on the ground and bring your foot to hover over the mirror to see if you've stepped on something by accident and didn't realize it, or if you have a callus, a blister, or if there's anything unusual. Bring that to the attention of your podiatrist. Number 4, if you develop a wound, never soak it. Clean it with soapy water and pat it dry, and change it with a Band-Aid daily. You'll want to let your podiatrist know if it's red, if it smells, if there's pus draining, if it hurts, if it's not getting smaller over the week, or it's just simply not looking right. Number 5, manage your diabetes with food and prescribed medications. Fuel your body by choosing nutrient-dense foods that don't spike your sugars. Keep it simple by eliminating refined sugars, candies, sodas, fast foods, alcohol, and ultra-processed snacks. Work with a nutritionist for a tailored plan. Following a Mediterranean diet or a whole food diet is a great start. Reach out to your primary care doctor or endocrinologist for medical management and lifestyle changes. Number 6, prioritize exercise to help control blood sugars and improve your overall health. The American Heart Association recommends getting 150 minutes a week of moderate intensity. Add strength training or resistance training 2 days a week. If you're having pain or you have a diabetic foot ulcer or just experienced a surgery or have a broken foot, make sure to see your podiatrist or orthopedic surgeon first to get the clearance to move into an exercise regimen that works for you. Number 7, get the right diagnosis before grabbing over-the-counter medical products. Self-treating the wrong diagnosis can be harmful, delay care, and lead to hospitalization. An example that I see frequently is people self-treating a corn or a callus with a medicated pad that they can purchase at the store, thinking that it would be safe to do so. But if you have diabetes, neuropathy, or circulation problems, you really don't want to do that. Check with your podiatrist for a better treatment plan. Number 8, have your own dedicated nail clippers. These are personal hygiene products, so dedicate a set to each member of the family in the household and wipe them with alcohol before and after use. Take caution in nail salons that do not specialize in high-risk feet. Your podiatrist may be able to provide preventive foot care services or make recommendations as to where you can get your toenails trimmed safely within your area. Number 9, trim your toenails straight across the skin edge and avoid digging into the corners. Number 10, wear properly fitted shoes, which should allow your toes to move freely and feel comfortable. It might be hard to do with neuropathy, so ask your podiatrist to help measure your foot and get shoe recommendations for your foot type. You're looking for shoes with a wide toe box and a stiff insole. Number 11, choose white socks labeled for diabetics. Socks designed for diabetics are usually looser in the elastic so it doesn't compromise your circulation, and it doesn't have rigid seams which could create a friction blister or create a new opening or sore. Avoid barefoot walking so you don't accidentally step on something sharp, and also avoid sharing shoes to prevent contamination. The reason for white socks is that it provides as an indicator should you experience a cut that leads to bleeding, and the sock can catch the bleeding, especially if you can't see or feel the bottom of your feet. And lastly, number 12, use medications prescribed specifically for you for your current condition. If you were given a topical medication for a diabetic foot ulcer, for instance, make sure you know when and how to use it correctly. A wound product for one kind of wound is not necessarily appropriate for another kind of wound, so always check with the prescribing doctor. The most important part about preventing foot complications is to be proactive with preventive care instead of being reactive or waiting for something bad to happen to see the doctor. Amputations are preventable in many cases when treated early. Now that you know about the diabetic foot and how to prevent complications like amputations, the next best thing you can do is to make an appointment with a specialist like me who can tailor the treatments to your needs. My goal is to help you have the tools for proper self-care and know when to seek medical care. Early diagnosis and intervention is key to preventing complications and improving the quality of life for those with diabetes. I hope you found this to be helpful. I'll link the bonus PDF down below for you to review. Feel free to share this with your healthcare team. Thanks for being here.